Good morning, everyone. On the offset, I'd like to thank Dr. Sumanta Day and the management and team from Ruby Hospital for giving us this wonderful opportunity. It's really overwhelming to be back in Calcutta every time. This is the place where I've learned my laparoscopic and from where I began my laparoscopic journey. So this is a very important topic, ergonomics. Why it is important? See, as a surgeon, as a practitioner, we want to have a really long career and a long life in this surgical branch. Knowing our ergonomics will help us to perform surgeries better, to be give better results to the patient as well as to remain fit, so that we are able to be in this whole profession and give good quality outcomes. So what is ergonomics? So ergon means work and nomos means natural laws or arrangements. So it's basically a scientific study where we study people at work in terms of the equipment, in terms of the environment in which they are working, in terms of the workplace layout, and safety and productivity as well as the training. So it involves all these things, and ergonomics is related to in all the sectors of the professions, including IT and all, where the companies have a very focused area to give good ergonomics to their employees so that the productivity increases. So ergonomics is basically to make things better. Now, why we are talking about this? When we were trained for open surgeries, I think we never talked about this topic. There was no discussion on ergonomics when we were getting trained for in the open surgeries. But why we are talking today in laparoscopic surgery? Because of this difference. See, in open surgery, you are standing with your hands by your side, operating at your comfortable level. But in laparoscopic surgery, you need to accommodate. It is good that we stand straight, which is not so in the open surgery. Your neck is bent down, which can lead to other problems. But in laparoscopy, though we are standing straight, but the continuous feedback from the monitor and the hand-eye coordination, as well as the adaptation of the brain to see a 2D image and process it as a 3D, it leads to a mental fatigue as well as physical fatigue. In open surgery, if we think, it is usually a reflex that once we are operating something, we start moving around. We'll be pushed, our weight will be on one leg, sometime it will be on another leg. But it's not so common in laparoscopy. Usually we stand stiff, and since we have to operate a lot of things from the pedals, that leads to a different kind of posture, which is little difficult than open surgery. So more than 15% of the surgeons, they still report frequent back pain and stiffness following laparoscopic surgery. Goal of a proper posture is comfort, efficiency of movement, minimization of the risk of any musculoskeletal injury. What can happen with poor ergonomics? For the surgeon, it can lead to eye strain, cervical spondylosis, irritations, mental fatigue, shoulder problems, lot of shoulder aches after doing a long surgery, and carpal tunnel syndrome, thin arm neuropathy, and radiculopathies. All these things will lead to? All these things will lead to a poorer surgical outcome, poor surgical quality, which will lead to shorter life as a surgeon, as well as give a poor outcome for your patients. This I have already told. So there is a continuous cerebral adaptation which is happening once you are doing laparoscopic surgery. It's like driving a car, because you cannot see the stick again and again. So you are seeing straight into the monitor, and your hands are moving in another plane altogether. So what are the concepts for ergonomics in the OT? One is all the hardware is on a trolley is advantageous. Having a modular OT is really good. It gives ease of working around the OR. Energy sources should have a separate power supply, and electric installations are very important. There is a lot of electrical stuff happening in the laparoscopic OT. So all these earthing and wiring should be done very well. So first we'll go with the OT table. OT table is one of the most important thing once you plan to do a laparoscopic surgery. And if you want to graduate to advanced laparoscopy, where you are planning to do surgeries for a longer duration, some bariatric surgeries, colorectal, all those things will require special tables which should have, which can be lowered down to minimum level, that is at the floor level, 64 to 77 centimeter above the floor level. Also, the degree of movement in the table should be very good. It should be electrically operated. That's how you will be able to, utilize the gravity adequately for providing retraction while performing a laparoscopic surgery. Then the other thing is the instrument handle. Why we have to place the OT table so down? Because you cannot operate a complete surgery with the hands flexed at the elbow. It should not be like I'll be performing a lap chole with my hands like this, or a hernia or a bariatric surgery. Your arms at the elbow should be between 90 to 120 degree. It is always better if your arms are little lower than your elbow. That will not lead to a fatigue in your arms. Also, if the table is high up and you are performing the surgery, that will lead to slouching of your shoulders. So if you are operating like this, it won't be possible for you to operate like more than 15 minutes or 20 minutes, or else you will be having very stiff shoulders. So these things are really very important once we plan to do a longer duration surgeries. Today we are doing Whipples, abdominal wall reconstructions. All these surgeries are long duration surgery. It may take 6 hours, 8 hours. So a comfort level for your body is very important. Other thing is the monitor position. So monitor has to be placed a little lower than your eye level. It should not be placed at your eye level. It should be placed little lower, so that there is little flexion in your neck and the neck is not extended for longer duration. The ideal angle is between 15 to 40 degrees or maybe around 25 degrees. So here you can see this is a simple case of lap chole. Don't mind this monitor. This is our secondary monitor here. So if you see, I am operating this case. For my height also, I am using a stool to stand on it. Why? Because this table does not go very low and the patient was obese. So to get a adequate position for my arms, I know whenever I ask for a stool, everybody in the OR has the same question, that why I am asking for a step to stand on. But never mind that. Always think that if I have to perform this surgery well, then our own comfort should be the topmost important thing to be done. So here again you can see in the first image, if you see my left arm is at 90 degree at the elbow, right, and the right arm is also, but you cannot be in this position for quite long. So after this table is brought down, and in the another picture you can see my arm is like quite extended. Now it's quite relaxed. My shoulders are relaxed. They are not really above my neck level. So this is what the ideal position is to stand. Here you can see the elbow height, and yeah. So this is the elbow height. This is the monitor 15 to 40 degrees down, and the foot pedal has to be near. It should not be that the foot pedal is somewhere else and it won't be possible for you to perform a surgery like that, and it happens usually. So make time, ask your assistants to place everything near you so that it's easy to be followed. One more important thing is this, I also noted very late, I think 6 months back. Ramana sir is here, so he only told me this in the last thing. So once we are standing in the laparoscopic surgery, we usually are very fixed at our knees. If you note, after sometimes you will have very stiff knees while performing a longer surgery. So it is always a good idea to have a little bend in the knees, keep it loose. So that is one important thing. But once you are doing the surgery, you will forget about it. Again, you will be standing very stiff, and after some time you will feel that there is some pain in your knees. So all these things are very important. Other thing important is if you are performing a longer duration surgery, take a break. Take a break. Move around little here and there. Take your eyes away from the screen. It's not a marathon race that we have to finish on time. So there is no limit for the time. You can take a break for 2-3 minutes, move around and come back and start your procedure, continue your procedure from there. Other things, foot pedal and wire cables I have already told. So there are special draping sheets available for laparoscopy. It makes work quite easy. There is less tangling of the wires and all. Those can be used, but yes, it adds to the cost of the surgery, and I think We can make such sheets with our standard drapes also. Then we come to port placement. So there are three main angles which needs to be which we need to define. One is the manipulation angle, other is the azimuth angle, and the third is the elevation angle. So what is the manipulation angle? It is the angle between your two instruments, your two arms, where they are meeting, that angle. So if these two arms are meeting at 90-degree angle, if I am working like this, then there will be lot of strain over my trapezius muscle as well as my deltoids. Okay. So suturing like this or performing any surgery like this for a longer duration will lead to very stiff shoulders and very stiff back. So this angle ideally is to keep your arms by your side. The arm has to be by your side. The angle which will be found will be somewhere between 60 to 75 degrees. So this is the adequate angle to perform any surgery. Here you will be able to get maximum out of what you have in you to perform a surgery. Then comes the azimuth angle. Azimuth angle is between your scope and the instrument. So in a triangulation, I'll show the diagrams also. So just imagine here once. So if this is your manipulation angle, and if I cut it in between, then this shorter angle will be your azimuth angle. Okay. And the elevation angle is how much the instrument is elevated from the isoplanar from your patient if the patient is supine. So angle between the instrument 60 to 90 degree I have already told you, and between the instrument and coronal plane, which is the azimuth angle, is 45 to 60 degree. So here is the diagram. So you can see the first, this is between the two instruments. It is the manipulation angle, adequately around 60 degree. Azimuth angle ideally should be equal. So this is the scope, and the second number is the azimuth angle, which is 30 degree on each side. And the elevation angle is the angle between your patient and the instrument. Okay. So if this is lower down, again it will cause lot of trouble on your shoulders and the arms. So again the similar diagram, I hope it's clear now. So this is manipulation angle, this is azimuth angle, and the elevation is here between the horizontal plane and your elevated instrument. Then comes the concept of triangulation and sectorization while placing the ports. So as a normal, as we are made by the God, so we have eyes in the center of our body and two arms by the side. So similar principle is followed when we are doing a triangulation. So camera stays in between and both your instrument arms comes from the side. So this is how we operate usually, and it's quite easy to switch from open surgery to a triangulation port. But yes, this can become difficult depending on your arm length also. So what port position may be simpler for me, may be difficult for Dr. Sumanta, or it can be vice versa, because the arm lengths are different. For my arm length, I can place a port farther away and maybe get away with it. But for a shorter arm length, it will lead to more abduction on your shoulders and more strain. So triangulation port is similar here, that the target is in between. This is the scope and these are the two working instruments. To overcome this, we can use sectorization of the port, where the camera is on one side and both the ports are on one side. What is the advantage of these type of port? That the camera person does not come in between your way when you are performing the surgery. It is easier for you to bring both your arms towards your shoulder. Adduction is easier as compared to triangulation. But yes, the learning curve for sectorization ports is little higher as compared to triangulation, because it's not the most natural position, as I've already mentioned. Other thing is placing the first port. So target organ should be 15 to 20 centimeter from the optical port. Ideal distance between the tip of the scope and target organ is should be 7.5 to 15 centimeter. Each port which is placed on each side of the of the optical port should be around 6 to 7 centimeter. So this is how your ports are placed if your target organ is somewhere at the epigastrium or the hiatus surgeries, right? Then other thing is hand instruments. So in laparoscopy, the work is also more. So if you're moving your instrument 3 degrees, the tip of the instrument only works 1. So it's 3:1 ratio as compared to open, which is reversed. So more work is definitely required, more work as well as more concentration is required while doing a laparoscopic surgery. This is about the sectorization of the ports I have already mentioned. And next is laparoscopic hand instruments. So most of these instruments, if you buy off a good company, most of these instruments are very much ergonomically made. That is why they are so expensive. There is a lot of research which go in while making these instruments. And if you compare them with very local instruments, you will find that there is a difference between the ergonomics of the two and the comfort of using them. Most of the instruments are pistol grip with these grip rings. It is also important to note how you hold the instrument. So this will show you in the OR. Your right hand instrument you can hold with this thumb and your finger, but it's not necessary to hold the left hand also with this thumb and the finger, because most of these instruments, they open once you unlock, once you remove your hand from the handle. So this grip will be much comfortable as compared to this grip. Always remember that. So this I think will demonstrate you in the OR. Then comes the most, the instrument which I love the most, the needle holder. So it has different type of grips. Depends on your comfort, which type of grips you like. So for me, like I am very comfortable with the inline type handles. And these are the pistol type grips. Similar kind of needle holders are also available. So these are the 3 types of grips in the needle holder. This is the coaxial grip, this is the pistol grip, and these are the ring time. Ring time is rarely used now. So basically this is a basic about ergonomics. So laparoscopic surgery, yes, it is a very pleasurable thing to do if your ergonomics are alright. If your ergonomics are not alright, it can be really painful to do it. Always remember to be fit. Do regular spine and shoulder exercises, back exercises, maybe yoga. And to help you with this, so this is again, sir is here. So this is Arcuate Lines. It's a hernia magazine, and in each topic we are covering something about fitness. Most of these regimes will help us around, to gain that flexibility where we can work better. So this was from the first edition where there was reset your regime, and from the second edition this was also a very nice article, hand health routine for surgeons. So these type of exercises, if we do, it will give us a better fitness level to perform surgeries as well. And this is the ultimate goal of a surgery. See, these are the 2 monitors if you see here. Please don't mind that I am not wearing mask here. So this is a monitor which is very high up, okay. So this is not to be used. This is our secondary monitor, we don't use it. This is the monitor, if you see from my height, it comes below my eye level. Okay, all my arms are extended at the elbow. The patient table is quite down, head is down, right? And that is why all of us are having gala time. This is at 2 o'clock in the morning we were operating. So this should be your outcome. Once you are performing a laparoscopic surgery, everybody should be happy, including your assistant and your anesthetist. And to end it, so I would like to invite you all for the Deep Impact AWR conference, which we will be conducting next year in Delhi from 23rd to 25th March. It's an international global conference, and Ramana sir is here. I think he'll be able to shed more light on it. So register fast, it will be really good. Yeah, thank you.